Matthew Jose. So today I'm bringing you a video of the anatomy of the rib cage, so the thorax region, and this is going to consist of the sternum as well as the 12 ribs that we as humans have. So the main function of ribs is to protect your organs, and the two main organs that's located within the ribs that we know of are the lungs and the heart. And then the ribs are connected via external and internal intercostal muscles. And I'll do the muscles of the musculoskeletal system, muscles of the upper limb, the thorax, the muscles of the head, and all that in a separate video. So for now, if you've been watching my videos previously, I've so far done the upper limb, the humerus, radius ulna, the clavicle, the scapula, the cranial anatomy. And now I've done the vertebral anatomy as well. Now I've reached the point where I'm on the ribs, the thorax region. There isn't much very great detail that there is to go into here, but I'll try to explain it as much clearly as possible. On the left, as you know, I always have a 3D anatomy, which this is simply an app that's downloaded onto my computer. On the right, we have an image taken from Google, which is illustrated with diagrams and illustrations. So, if sometimes you don't understand my accent, or if I don't pronounce something correctly, you can always refer back or move your eye across to the right of the screen so you can actually read it yourself. Alright, so let's get started. So this middle thing here is known as the sternum. So collectively, this whole thing here is referred to as the sternum. Now, the sternum consists of what we call the manubrium. We have the body, the main body, and then we have something very small, which can't be seen very clearly because of the contrast of the anatomy or the image. But this is known as the Siphioid process. So if you look over to the right, you have the manubrium here, then you have the main body, and this blue thing here is the Siphioid process, and I'll come on to why this is in blue. But for those that you already know, it's basically cartilage, hyaline cartilage. But that's known as the Siphioid process. So if you do ever get an image in one of your exams, this thing doesn't even come out properly. Sorry. Siphioid process. So now, if I was to zoom in on the sternum, or if I was to isolate that by itself, so this manubrium of the sternum, and if I was to isolate that by itself, you can see that if I was to turn it around, you have something which is known as the jugular notch, which is present here. This curvy bit here is known as the jugular notch. And then these two areas here, this one and this bit, is where the first rib connects to. So you have the first rib articulation. Now if I was to turn this around slightly, so if the lateral view of the manubrium is this way, the posterior, and then another lateral view. So if you're wondering what these little hole kind of things are, these are where the ribs attach to. Now if I was to bring it back, so that's the manubrium. Now here is the body of the sternum, and then here we have the Siphioid process, which if I isolate that by itself, it looks something like that. The Siphioid process, very little thing, and it's made up of cartilage. Now, going back, Now we have the ribs, which you can see if I flip this around slightly, zoom out, and I turn this around, you can see the ribs that goes around. So the ribs has 2 points of connection. So first one, if I was to zoom in here, if I was to isolate the first rib by itself, you can see that the first rib up to here, 3/4 of the whole thing is rib or bone, you could say, and then there's a quarter of it, this blue bit which I'm pointing to on the right, it's made from cartilage. And this is hyaline cartilage made from type 2 collagen. That's hence the reason why when it's fresh, so when you dissect an anatomy and it's really fresh, then this cartilage appears really shiny and glassy finish. It has an outer covering which is known as the periosteum. So this is how the first rib looks like. So if I was to go back, so you can see that when you move this around, the first rib, zooming in on this bit here, you can see that the first rib articulates with the thoracic T1. So if you ever want to feel where your first rib is, all you need to do is find your collarbone or your clavicle, and then you just press, palpate downwards, and that's your, whatever you feel, the hard, bony, rigid feeling there is the ribs, the first rib, and that comes off the thoracic region, the T1 vertebrae. And you can, before you knew that this little green thing here is the transverse costal facet, and here is the superior costal facet. The costal means costal cartilage, costal ribs. Sometimes we refer to the rib cage as a costal ribs, so hence the reason why they're called costal. Now this bit here is missing, so you can see this area here. If I was to get a pen, if you don't clearly see it, you can see that there's nothing shown there, and that's because this bit is meant to be connected to the this part here, as so, like this, and this is meant to be actually, if I was to draw this out, hyaline cartilage. Hyaline cartilage is a form of cartilage. It's one of the weakest cartilages in the cartilage family, and it forms the nasal cartilage of the nose and nasal cavity as well. But this is how it connects, and you can see, if I was to draw another example, it'll be like this, but it's missing. This whole area is not shown in this diagram, to get an idea. So I'll zoom back out now. So you get your first rib, first, second, third, fourth, fifth, sixth, seventh. So it goes in orders. The first rib comes off T1, the second one comes off T2, the third one comes off T3. So for example, if I was to name the fifth rib or the sixth rib, then you can clearly know that it comes off T6 or T5. Now once you get to the seventh rib, on the right you can see that the first 7 ribs, so 1 all the way down to 7, is known as true ribs. Then from 8 to 12, so if I was to move, so that's the 7th one, and then from 8 to 12 it is known as the false ribs. And 11 and 12, because they end right there, they're known as floating ribs as well, which you can see here on the right. Now the main thing that you want to be aware of is, if you look over to the right, you can see that the first rib has its own cartilage, and it connects here, this point here on the manubrium, and then the second one connects right there, the third one connects here, the fourth one connects, so first, second, third, fourth, fifth. So first, second, third, fourth, fifth, and then what you have is 6 7. 6 and 7 connects to their own one, so there's 6 there and there's 7. And then what you have is 8, 9 and 10 all connect onto the 7th one. So you can see it all articulates together with the 7th one. And they all, so there's one main branch, and the 8th, 9th and 10th connect to the 7th one. 6th one has its own one, 5th, 4th, 3, 2, 1 have their own one. So I also zoom into this one and label it so you get a better view or a better idea of what I'm talking about. So this attaches to the first rib. Here is the second. Here is the third. The fourth. Now maybe by second and stuff I'm pointing to this, by the way, so that you don't get confused. I mean, I'm pretty sure you have enough common sense to understand that. The fifth is this one here. If I was to zoom in slightly, sixth. Okay, that 6 is a bit dodgy, but yeah, you get the idea. 6th is here. 7th is this little bit here, which I'm going to circle now. So right, so if you're looking at this image here, you can tell that the 8th, 9th and 10th one all connect onto the 7th one. So it's almost as if they're all connected to one main branch. And the 11th and the 12th one, they're known as floating ribs, which you can see here. They don't connect onto the sternum at all. Right, now I hope you understood that. If I was to zoom out, the space between the two ribs is known as the intercostal spaces, so here, and usually it's not left hollow. There is usually muscles which surround the inside of the cage and then the outside as well. So the inside cage muscles are known as intercostal muscles, and the ones outside are known as external intercostal muscles. Then you have the costal cartilage and the costal margin. So, I mean, that's simply the anatomy of the rib cage. And if you like to, please leave a comment on how I can improve my videos, and maybe if you don't understand clearly, or if you feel like I'm not explaining it to you very detailed, it would be much appreciated if you could leave a comment. Please do share the video if you have liked the video. If you like the video, subscribe, and tell your friends, tell your medical friends, tell all these university students, and get the video sharing. It's all good to learn. So, thank you for tuning in again, and it's much appreciated.